This video is going to be on renal disease, and we classify renal disease into either acute renal failure or chronic renal failure. Acute renal failure, you might also hear of it called acute kidney injury, and chronic renal failure is also known as chronic kidney disease. The etiology for acute renal failure includes a variety of toxins, infectious agents, neoplasms, and urinary tract obstruction. And the etiology for chronic renal failure includes various familial causes. It could be a sequela of acute renal failure, but oftentimes we really don't know what the inciting cause was. On history, patients with acute renal failure often have a less than 2-week onset of more severe clinical signs, and it often includes anuria, meaning there's no urine production, or oliguria, meaning there's decreased urine production. Animals with chronic renal failure have a chronic clinical signs that are often progressive, and the clinical signs include polyuria, polydipsia oftentimes. On physical exam, animals with acute renal failure tend to have a good body condition score, and if you palpate the kidneys, they might be normal sized or enlarged. But animals with chronic renal failure tend to have a poor body condition score, and their kidneys tend to be small from fibrosis. On CBC, the animals with acute renal failure tend to have non-specific findings, or NSF. But since the kidneys make erythropoietin, animals with chronic renal failure have decreased production of red cells, so non-regenerative anemia, due to a lack of erythropoietin production by the kidneys. The chemistry findings are similar with only a few differences. Both acute and chronic will have azotemia and hyperphosphatemia. All of these substances are considered waste products, and the kidney gets rid of these substances. So with either acute or chronic renal failure, there's decreased excretion of these wastes, and they build up in the blood. So all of these increased because of decreased GFR. Also with acute or chronic renal failure, you can see changes in the calcium concentration, and you'll learn more about that when we talk about calcium and phosphorus later in the semester. But I did wanted to mention here that the kidney does activate vitamin D to its most active form in species other than the horse. So if you have chronic renal failure in species other than the horse, you would expect to see hypocalcemia due to decreased activation of vitamin D and then decreased calcium absorption from the intestine. The potassium concentration tends to be different with acute and chronic renal failure. With acute renal failure, there tends to be hyperkalemia, and this is because the kidneys excrete potassium. So if the animal's not producing urine or a little bit of urine, that potassium is not getting outside of the body. But with chronic renal failure, these animals tend to be polyuric and polydipsic. So with prolonged diuresis, there's loss of potassium from the body. The urine-specific gravity tends to be similar with both acute and chronic, so you'll have inadequately concentrated urine for the species, so less than 1035 for the cat, 1030 for the dog, and 1025 for large animals. But with acute renal failure, the sediment tends to be active, and that means that there's increased substances in the sediment. So you might see casts, you might see crystals such as with ethylene glycol toxicity or with melamine toxicity. But with chronic renal failure, the sediment tends to be inactive, meaning that it's kind of boring and there isn't that many cells or casts or other substances in the urine. So that pretty much sums it up, the differences between acute and chronic renal failure, how we differentiate them both clinically and with our ClinPath data.